Hello, wonderful people, great nurses and brilliant nurses. Okay, guys, so today we are going to be talking about the list of the medication that you are expected to know before writing your NMC UK OSCE examination. All right, if this is what you are interested in, stay tuned and make sure you watch this video to the ending, and also repeat it after and after again so that you can be able to get knowledge on the things that you're supposed to know, medication you are ought to know regarding your implementation station. All right, so guys, let's dive into what we have today. Number one of what we have today is a controlled drugs, that is a CD drugs, and this medication are the one that you are expected not to be given. You cannot administer this medication during your OSCE examination because you are not yet licensed to do so. All right, these medications now, controlled drugs, are the ones that is supposed to be administered by two trained registered nurses. Both of you are going to look at the pack, count the medication, also countersign it, and make sure that after everything you keep it back to the locker under lock and key where it's supposed to be. You are not in any reason to administer this medication when you are doing your OSCE examination. Code it code 2 or code 6, which is incorrect prescription. All right, so the first one of what I have today is oral morph. Yes, oral morph. This medication is normally used to make the patient to be calm, induce sleep. Okay, so you are not ought to give this medication. And also morphine sulfate. Please, if you see it on your OSCE exam, do not administer it. All right, code it code 2 or 6, incorrect medication. All right, prescription. And then also metadine, don't administer this medication. Please do not administer this medication. The next one is codeine. If you've seen codeine sulfate, please don't administer. You are not yet licensed to do so. Is a fail because it's under control drugs. All right, and then the next one I have here is a oxycodone. Do not administer, guys. Code it code 2, okay, with date, time of this medication and sign the reason why you did not give it. All right, under omitted medication. Okay, good. That is if it is not under required prescription. If it's under regular medication, please do not administer it. Code it, go and put it under omitted medication with date, time, and reason that you did not administer it. Okay, guys, and then side effects of this control medication is normally nausea and vomiting, tiredness, dizziness, sleeping, because most of them has the sedative effect or calming effects. All right, so moving over to the next one we have today is next one you are expected to administer when you are doing your OSCE examination that you are allowed to give is oxybutynin. Oxybutynin is medication that is used to treat overreactive bladder. Yes, when someone is frequently having sensation to go to the toilet to urine, this medication is used to control it. All right, overreactive bladder. It's not necessary that the person will enter into the restroom and urinate, but sometimes you receive a sensation in your sensory perception in your brain that you want to go and urinate without you going urinating actually when you get there. Oxybutynin is used to treat overreactive bladder. Okay, the side effect of this medication is constipation. Yes, constipation, because it causes dryness, dry skin, dry mouth, all the signs of dehydration. So encourage the person to drink frequently, at least 2.5 liters of water in a day. Okay, and then the next one is calcium carbonate. Okay, and this medication is for strong bones, strong teeth, and side effects of it when you consume it in excess is overcalcification of bone, nausea, and vomiting. All right, okay, and also then the next one we have is proton pump inhibitor, which under it we are having lansoprazole and then omeprazole. All right, this medication is used to treat gastric ulcer and then reflux and indigestion. All those things is used to treat. The medication is also used to treat gastroesophageal reflux. Yes, gastroesophageal reflux. The side effect is nausea, vomiting, discomfort. Yeah, that's all. Okay, and then the next one we are having is anti-hypertensive medication. Anti-hypertensive medication. We have lisinopril, losartan, amlodipine, okay, lamivudine. Yes, let me come again. Lisinopril, losartan, lamivudine, and amlodipine. Okay, amlodipine, sorry. Okay, that is it. And this medication is used to treat high blood pressure, okay, and prevent stroke and heart attack. All right, using to treat high blood pressure, prevent stroke and heart attack. This is the indication for this antihypertensive medication. Amlodipine, lisinopril, losartan, and then lamivudine. All right, that is it. And then the next one we have today is antihyperglycemic medication. All right, antihyperglycemic medication. All right, now these medications are used to regulate blood sugar level. All right, please make sure you monitor the patient's blood glucose level before giving this hyperglycemic medication. Okay, make sure you monitor the patient's blood sugar level. You can ask the assessor, please, what is my patient's blood sugar level this morning or today? She will tell you. You can now say, okay, I can see that your blood pressure is within the normal range, all right, or is below. I'm sorry, I'm not going to administer this medication because you are having 3.5 or 2.5. We know that normal blood sugar level is 4.5 to 8. Okay, yeah, let's move on. And then side effects of this medication can be hypoglycemia, low blood sugar. That is it. Nausea, vomiting, okay, and all the signs of hypoglycemia. All right, okay. Then the next one we are having now is analgesics. Yes, analgesics, which is paracetamol. Yes, and then also aspirin. All right, so that is it. And aspirin is brought in medication. Okay, yes. Side effect of it is nausea, vomiting, headache, and bleeding when the person had a fall or subdural hematoma. If there is any fall, it can lead to serious issue if you are taking aspirin. Okay, and then under paracetamol, side effect is nausea, vomiting, kidney failure if it's major issue. Okay, and then another one we have today on our list is make sure you monitor high blood pressure before giving any antihypertensive medication. Please ask assessor, please, what is my patient's blood pressure level today? Okay, she will tell you, and then you will know if it's below or if it's normal or if it's high before you can administer. Make sure you are asking it, especially when you are dealing with medication that is pertaining to the heart, okay, blood pressure, anti-arrhythmic medication, and also blood glucose monitoring medication. All right, okay. So we also have the one that is using to treat irregular heart rate and blood pressure. We have bisoprolol and atenolol, digoxin. Okay, yes. And then next one, then under this one, please make sure you monitor patient's pulse rates and blood pressure. You can ask assessor, please, what is my patient's blood pressure and pulse rates today? Make sure you are asking it. If you did not ask it and administer this medication, it's a fail, guys. It's a red flag. Yes, ask, because the patient might be having pulse rates of 59 or 58, and then you are administering this medication. You're supposed to give this medication if your patient is having a normal pulse rate from 60 above. That is it. All right, Okay, and then side effects be nausea, vomiting, just a normal usual side effects. Okay, and then if there is any omitted medication, please make sure you are coding it and say the reason why you coded it using code 2. All right, okay. Now we have antibiotic medication. One is a nitrofurantoin, okay, co-amoxiclav, amoxicillin, clarithromycin. Now let me make you clear. If you are having amoxicillin, amoxiclav, remember that it's under penicillin derivative, and if this patient is allergic to penicillin derivative, do not administer this medication. Yes, do not administer it. And then clarithromycin you can give because it's not under penicillin derivative. All right, and these medications is just used to treat infections. Side effects: nausea, vomiting, dizziness, tiredness, all this. That is it. All right, and then we also have diuretics such as furosemide. Okay, what is the function? To reduce swelling, to reduce edema. It's also used to treat heart failure. Yes, okay. And then side effect of this medication is frequent urination. Yes, frequent urination. That is why you have to be monitoring this patient's heart rates. All right, frequent urination. Make sure you are monitoring that patient's heart rate, because sometimes when you urinate in excess, you are losing fluid and you are not replacing that fluid. It can lead to low blood pressure. That is why when someone is having low blood pressure, you can encourage the person to take adequate fluid intake. It will just come up on its own. That is it. Okay, all right. And then another one under this diuretic, we have spironolactone, benzoflumetazide. Yes, spironolactone and benzoflumetazide. I'm going to be listing all this name of this medication so you can be able to get the adequate spelling for it, and then you can search it and then read through it. Okay, just get acquainted to what it does. That's the indication and side effect, because when you are administering this medication, you are going to tell the patient, okay, Mr. Jones, I am this medication, spironolactone is the name, is going to help to reduce excess fluid intake on your system. Now the side effects you are going to get is frequent urination and low blood pressure. So I will encourage you to take adequate fluid intake while taking this medication. Okay, she will not tell you, all right, nurse, thank you. Yeah, that is it. That is why you have to know all this medication before writing your NMC UK examination, so that you will not be throw off balance. Okay, and then next one we have is anti-emetic, that is anti-sickness medication. The first one is ondansetron. Yes, ondansetron, and then cyclizine. Yes, is there. Cyclizine and ondansetron is there. Is used to prevent nausea, vomiting. That is why I said it's anti-sickness medication. And then side effects of this particular medication is also nausea and vomiting. That is it. All right. Most of this medication is nausea and vomiting. Okay, apart from the ones that have a specific side effects. Okay, now next one we have is supplements such as ferrous and then ferrous fumarate. Yes, ferrous and ferrous fumarate is a supplement to prevent deficiency such as anemia, all right, or low blood in the system. Okay, side effects: nausea, vomiting. All right, and then also we also have thiamine, which is vitamin B1, to treat deficiency as well. All right, then also we have another one known as levothyroxine. Yes, levothyroxine is used to treat underactive thyroid gland. Yes, all right, and side effect is nausea and vomiting. And then this particular medication, levothyroxine, you are going to give it 1 hour to 30 minutes to an hour before the person will take breakfast. Is given in a particular time in a day, early in the morning, before the person is going to eat her breakfast or his breakfast. Guys, please take note of this medication. If you see it on your examination, make sure you are asking the patient. You tell the patient, okay, this medication is normally taken very early in the morning. Have you taken anything this morning? Yes, because some might got up from the bed and take a cup of tea. Yeah, that is it. So you are meant to give this medication 30 minutes to an hour before breakfast. That shows is given in a particular time of the day, early in the morning, maybe 7:30 or 6 o'clock in the morning. Maybe the person normally eats by 7:30 or to 8, I don't know, maybe 6 o'clock in the morning. Just make sure it's 30 minutes to an hour before giving the person any other meal. All right. And 10, we also have steroid such as prednisolone. All right, and this medication is used to treat allergy disorder and inflammation. Yes, side effect is increased blood sugar level. Yes, prednisolone causes increased blood sugar level. Okay, all right, but some people might as well have side effects like nausea, vomiting, and yeah, that is it. Okay, note, please, I beg you, give the blood medications that is due at your time. If your instruction is telling you to give medication that is on the 12:00 hour, give it. Do not give medication that is not due at your time. That is it. All right. So guys, this is all the medications that you are going to meet in your NMC nursing examination. Make sure you watch this video over and over again. Please, if you get value on this video, make sure you are subscribing, you are commenting, liking, and sharing to our fellow nurses and the beautiful nurses out there. Good chicks, love you guys. Thank you so much for watching. Bye.